Do an LP on him.
Do an LP? Do an LP? On a plane? It's hard enough doing a lumbar puncture on solid footing. Never mind trying to find a small space with an even smaller needle. And if you go too far, not much will happen except paralyzing the patient for life permanently. And he has no needle. What could he use? A biro? House MD Airborne. Not only has it been requested by our first ever channel member, Joseph Randomness Hughes, shout out to you, but it's also voted one of the best episodes in the entire series. Season 3, episode 18. Let's see if I can get the diagnosis before House does as a doctor working in London. No time to waste.
Fran? Is this okay? Fran? Oh, God.
Oh God, not again. Why has God cursed me with such a venomous beauty? At least she'll have the paramedics on speed dial and probably no CPR since this happens so often. So when people collapse like this, we as doctors try and figure out if it's one of two things: syncope or seizure. Syncope is when blood flow reduces to the brain so much that someone passes out. Think UFC fighter having someone in a headlock. Seizure is when the brain itself has disordered electrical activity and is usually associated with limb jerking, tongue biting, the person feeling tired when waking up. What this lady had looked more like syncope. The most common cause in her age group is of cardiac origin. Things like arrhythmia, outflow obstruction with aortic stenosis, silent heart attack, or she could have taken too many blood pressure meds. There's also a condition called sick sinus syndrome when the natural pacemaker in the heart just decides to go on holiday and fire for a few seconds. Could be that. But the episode title is Airborne. There was a cat in the room. She could have toxoplasmosis from cat feces or histoplasmosis. The cat also was somehow on top of the cupboard rather than his usual bed. Maybe it was hiding from something else. Or the fact that she was paying for a hooker may mean that she's done it before and now she has tertiary syphilis. Let's find out more.
Is this a motion sickness patch? Scopolamine can cause dizziness and blurred vision.
Fran?
I got a seizure, a code card.
Oh, it's a seizure. That actually makes it even more interesting. You see, if I'm going to be on the house on the diagnosis here, I'm going to really have to think laterally. Airborne could be a virus. It also could be a bird. And the cat got the infection from the bird and passed it on to the patient. It could also be that she got it while air traveling. She had this anti-sickness patch on. So I think that air travel theory could be more likely. So what can you catch while traveling or during the actual plane journey that can cause seizure? Could be dengue fever leading to encephalitis, Legionnaire's disease, Japanese encephalitis, cerebral malaria, even rabies. I would definitely want to include thick and thin blood films for malaria, urinary antigens for atypical pneumonia, nucleic acid amplification tests for dengue, CT head, lumbar puncture if that's safe, and an EEG to check for the seizure activity and then re-review after that.
I turned 58 last March. Same age my mother was when she died. Took the first plane that went to a warm place. Caracas.
Ooh, sleeping with hookers, getting impulsive, going on holidays. Can you guess what she's suffering from? It's a midlife crisis. Interestingly, midlife crises follow a similar pattern as the stages of grief. They start with denial, anger, and move on to depression, withdrawal, and then acceptance. It's all when we're faced with the idea of our own mortality as we reach the midpoint. We question our identities and what we've achieved in life, whether we've amounted to anything. It's tough to get through. Our lady is prone to some impulsive behavior. Who knows what else she did in Mexico? Should probably add an STI screen to the list as well.
You drink the water, eat salads, any raw foods?
I also did mezcal shooters and snorted cocaine from a homosexual man's stomach. I had sex with El Gordo.
Oh my God, she is a wild one. You may be wondering why he asked about salad. When people travel to less industrialized countries, the usual advice is to only drink bottled water. The reason why is because the tap water can be contaminated with parasites and viruses that can make you unwell. So many people go there, have their bottled water and still get unwell, wondering where the cause was. Well, the salad, which is obviously uncooked, is actually washed in that tap water that we were avoiding, which can lead to contamination. So we eat it away thinking that we're okay when it's actually not. I want to know more about this lady though. She seems quite fun and a bit unhinged.
Is anyone a doctor?
I'll go get her.
What do you want?
Do you really think I was gonna leave you stuck back here for 18 hours? Go on, enjoy.
Oh my god. So House went to a conference with Cuddy that was paid by the hospital, ordered too much food and adult content while he was there, decided to pay for his expenses by downgrading Cuddy from first class to economy. Now there's a medical emergency in first class and he's swapping with her so he doesn't have to deal with it. What an ass. But a genius ass at that.
Get a tox screen, Chem 20, STD panel, blood cultures, then you run a CT and you check her house.
Not funny. Fever, headache, severe abdominal pain, and a rash.
Ooh, I love the juxtaposition here between House and Cuddy being on a plane and the patient who is being managed back at home, getting sick, probably from traveling. I had a patient start having a seizure next to me when I was on a plane once. I provided first aid, got her into the recovery position. Luckily she was all right and we could continue on the flight. I didn't feel like I actually helped much, but the airline staff and the patient's mum was so thankful. Bless them. That is one of the great things about being a doctor, having the skills to help even a little bit with our experience. Now this episode is seeming like it's going to be a great one because we're going to have two cases and two patients in one. The one back home that Wilson's leading on and this one on the plane. Love to see how they're going to develop in parallel.
Look that way, because you're gonna throw up and I don't want it on me. You barf, you smell vomit. Wasn't expecting that.
Oh, it's not often that we see House eating a slice of humble pie, but he had the whole thing just then. He was just saying to the flight attendant that Cuddy is wrong when she was suspecting bacterial meningitis because he's a board certified infectious disease specialist and she just plans parking. Brilliant from the writers. Anyway, it does seem like the writers are trying to show meningococcus on the plane, but unless they're flying around the world twice, that's not really accurate. You see, the incubation period of meningococcus at a minimum is 1 day, but averages around 3 to 4 days. So even if they were exposed, they wouldn't actually develop the symptoms of rash and vomiting until much later. So that either tells me that the diagnosis is wrong and it's not bacterial meningitis, or the scripting is inaccurate. It could be norovirus instead, which is very common and typically causes diarrhea and vomiting in schools. Could also be salmonella or astrovirus. Either way, they need to probably turn the plane around. Otherwise, at this rate, there may be nobody to operate it.
Nothing in her house.
CT was a complete waste. She was negative for tumors, her blood was negative for drugs, heavy metals, tropical diseases, food poisoning, and STDs.
Okay, this lady keeps having seizures and all her investigations are normal. That makes this even more interesting. I do wonder why they haven't done a lumbar puncture yet though, and Wilson is trying to diagnose House's patient while House is trying to diagnose his full plane. Who will actually get it first? Speaking of which, I am actually opening a members hall of fame for you all. This is a list of the first 10 members who sign up and will stay on the channel bio. So join now to secure your place and get a say in what I react to next, as well as other perks you guys voted for. The earlier you join, the faster I will be able to react to your suggestions. If you're interested, press the join button down below. Now back to the video.
I'm an idiot. She's exposed herself to so much crap, I just assumed it was a zebra. It's breast cancer.
Since when is breast cancer treatable by motion sickness meds?
See, this reminds me of an old saying. The fact that Wilson thinks this is breast cancer. A blacksmith thinks a hammer is the best tool for every job. Do you really think that Wilson would be suggesting breast cancer here if he wasn't an oncologist? It's because of this psychological phenomenon called cognitive priming. The grandfather of priming research was John Bargh, who did a study in 1996 as a psychologist in Yale. He asked some participants to form sentences from random words, but split them into two groups. In the first group, it wasn't actually random words. They were all words related to being elderly, things like words like bitter, frail, slow, and the other had no theme. After that, he asked them to leave through the corridor, and the real investigation was how quickly they actually walked through, and he found that the group one who were exposed to the words related to lonely old age actually walked through the corridor slower than the other group that had the random words, and he concluded that it was related to that priming effect on the brain of being exposed to those words first. There have been some difficulties reproducing it, but some authors have been able to. Either way, it's still a very interesting phenomenon to know about. Anyways, I doubt she has breast cancer and brain metastases large enough to trigger seizures, otherwise they would have shown up on the CT head. And I wonder what House is up to now. I don't think he would have taken this approach with this patient.
You're wrong, and we're gonna start seeing neurological symptoms soon. Seizures, paralysis, ataxia.
And up! Don't play the cripple card with me.
Okay, so House is refusing to believe that this is an infectious disease and thinks it's food poisoning now from Shiga toxin in the sea bass or potentially the kebab that caused this. The incubation period is way too short for that. This patient is rapidly deteriorating as well, and he probably has septicemia and needs immediate IV antibiotics if this is meningitis leading to encephalitis. Otherwise, his chances of survival without permanent disability become really slim. The rash we saw earlier on the lady is classic. And to any of you that have children and are concerned about a rash like that and your child is unwell, you can use something called the glass test. Basically, you hold up a clear glass against the rash and push against it. Usually a rash should disappear when you do that as the capillaries lose their blood, but if it stays there, then that's called a non-blanching rash, and that needs urgent medical attention. If your child is unwell, then definitely go to an emergency department as soon as possible.
My right eye, I can't see.
Radiation poisoning accounts for all his symptoms.
I have hair. I haven't had an x-ray since I got my teeth whitened.
You're pregnant.
What? Okay, so House is refusing to see what is in front of him here. In medicine, we tend to not believe in coincidences. If someone on a plane starts vomiting and another one goes straight after, then that is an infectious disease until proven otherwise, and those passengers should be quarantined. I also love the lack of protective clothing that they're wearing while dealing with them. I guess they're on a plane though, so there's not much that you can have here. You could channel your inner MacGyver, a vomit bag into some gloves, I suppose with a bit of skill and some scissors. Anyways, I still remember at the start of COVID, we were hearing about all the cases in hospital, and I was on a cardiothoracic ward. We still didn't have a case yet, and one of the patients started developing a cough. He'd recently come back from China. When we did some investigations, his lymphocyte count was low. On the blood test, I started chatting to the nurses, and they were really apprehensive about wanting to quarantine him because we'd never had a case before. People thought I was paranoid at that point. It turns out he did have COVID, but the whole ward got infected anyway about 3 weeks later, so it would have made no difference. Luckily, none of them got very unwell before we stopped doing non-emergency surgery in the unit. Anyway, House seems to be that skeptic in this case that just refuses to believe what might be in front of him, but he may be right about it. I'm not sure. Let's see. Our lady with right eye blindness is deteriorating too. They need to get the tests done quickly that we asked for. Otherwise, she could be losing full vision and who knows what else next.
Thought you didn't believe in coincidences.
I believe in statistics.
You're wrong.
Ooh, still believe in your statistics, House. Did you know that 90% of statistics are wrong, including this one? I know I've said that before, but it's worth repeating. So many body fluids in this episode. For the smart ones among you, here's a question. What bodily fluids should be sterile Write your answers in the comments section below. Vomit is my least favorite, probably because I love food so much and I hate to see it wasted. But back to our stats, so I can finally use my master's in medical research. There's a very interesting research paper published by a guy called Yanidis in 2005, who's a statistician, called Why Most Published Research Findings Are False. This is because researchers and humans are filled with so much bias that study outcomes are more likely to be a measure of the prevailing bias rather than an actual measure of the outcome itself. Studies are more likely to be false when there's a large financial incentive involved, or when there are other interests, when more teams are involved, and when there's greater flexibility in study design. So you have to be very careful where you get your information from, but I guess I'm preaching to the converted because you're already watching this channel.
Photophobia. Need antibiotics.
Want to smell yeasty? Staph smells musty. Some liver diseases smell of ammonia.
I do wonder about this. You see, in the developed world, we've become so dependent on lab tests. What would we do if they all just broke down? Before lab tests became widely available, physicians used to do what would be seen as some strange things, like tasting urine for sweetness to test for things like diabetes. Back in the 17th century, this guy called Thomas Willis from Oxford was the first person that actually connected this urine sweetness to a disease of the owner, later found out to be diabetes. It didn't stop there though. Later people actually built on that, and you can see from here that a flavor wheel for urine was developed, which helped allocate conditions to things like bitterness, sweetness, tartness of urine. Gosh, I'm glad I'm not a doctor in those ages. 17th century physicians also used to compare urine to the diagram on its appearance, called uroscopy, which is a similar concept to our modern day urine dip that we have today, where we basically get a stick that's got some reagents on it and dip it in the urine and test what the metrics are for different parameters like pH, nitrites, leukocytes, to test for infection and blood, etc. I am really glad we have labs. I have to say though, we have to be really careful just attributing all of these symptoms to meningococcus. It could still be something else like Rocky Mountain spotted fever, dengue, Lyme disease, enterovirus, Mediterranean spotted fever, babesiosis, West Nile virus, or no virus whatsoever, and they're all just making it all up and it's fabricated illness. They're all still on the cards.
Polyspikes over O1 and O2.
That's her left eye. Burst suppression on every lead.
She's comatose.
Oh, you may be wondering what on earth polyspikes and burst suppression are. They're non-specific signs on an EEG that could indicate epileptic encephalopathies, drugs, medically induced coma, something like Ohtahara syndrome, but usually patients with that syndrome don't make it past 10 years old. You also see an anoxic brain injury where burst suppression is actually a poor prognostic marker for the patient getting good brain function back. If she's in a coma, it's likely she won't be able to maintain her airway for long, so they'll need to intubate and put her in a ventilator as soon as possible. She's going to make it through this. I'm so surprised they haven't done an MRI brain yet and a lumbar puncture. This is what happens when House isn't there to whip them around into shape. Wilson, you're too soft.
Brain because of an invisible bleed the CT couldn't see? We should do an LP to confirm the presence of red blood cells.
And her brain herniates, and then she dies.
Ooh, okay, here Foreman wants to drill a hole to relieve pressure in the brain because he thinks there's a bleed that's not visible on the CT. Cameron wants to do a lumbar puncture to test this theory. They're trying to decide which is the best option. This scene is a bit inaccurate though for a few reasons. Firstly, you could just do an MRI if you were unsure about if the CT picked up a bleed or missed something. No risk, no need to drill into our poor unsuspected adventurous lady's cranium. That's definitely not the kind of drilling she was expecting. Secondly, if you're worried about raised intracranial pressure, there were other features you could have looked for. Headache, widening of the optic disc at the back of the eye, and vomiting. Doesn't seem like they've even looked for any of those. If you're wondering why an LP would be such a big deal, which is a lumbar puncture, it's because objects move from area of high pressure to low pressure, that's simple diffusion. So if you have high pressure in the nervous system and you start releasing the pressure down at the bottom of the spinal cord, the contents of the head will start moving downwards across the pressure gradient, and so you'll have parts of the brain trying to get out of the base of the skull, which we call brain herniation. Not good. Generally, we need our brain to stay in our head, so that's why the LP could be risky.
Give him to Pang.
Take the pills.
He's worse.
It's not meningitis. We're risking his life and flushing meds down the toilet.
And do an LP on him.
Do an LP? Do an LP? On a plane? It's hard enough doing a lumbar puncture on solid footing. Never mind trying to find a small space with an even smaller needle. And if you go too far, not much will happen except paralyzing the patient for life permanently. And he has no needle. What could he use? A biro? Nah, that's probably a bit too thick. There might be a cannula, to be fair, on the first aid kit. You could use that if it's long enough. Maybe a pink or longer. No chance with a blue. The thinner someone is, though, the easier it is for him to do the procedure. And it looks like Pang is of normal weight, so the anatomy would be fairly easy to feel out. That is a silver lining. You may be wondering why that test would be even useful without a lab. Well, usually if you have meningitis, the CSF fluid that surrounds the brain can fill with white blood cells and protein debris, which makes it cloudy while the body's trying to fight the infection. So if it's clear, it's much less likely to be meningitis. I love these episodes with 2 cases to solve. I understand why this is one of the highest rated episodes now, both doing an LP at the same time, but the one back home is kind of easy mode and this one is more like emotional damage difficulty.
Bad news is you have an illness. The good news is it's not meningitis. It's conversion disorder.
Oh my god, he did an LP on a plane and it was negative. That is big. But that doesn't mean everything is normal with Pang though. He still looks unwell, although House did test the rest of the plane and it does seem like he's right. They've got conversion disorder. He basically told them that tremor was a symptom of meningitis, and then all of a sudden everyone started tremoring of their left hand randomly. So you may be wondering what conversion disorder is and how that would explain it. It's when patients start to present with symptoms that can't really be explained by a medical condition. Historically in the 19th century, it was known as female hysteria, thought to only affect women, and that patients were fabricating their symptoms. But then Sigmund Freud coined the term and actually said that it was explained by the conversion of emotions from painful experiences into physical symptoms with psychodynamic theory. So what is wrong with Pang, and what did our LP for the lady back home show? I mean, with all of this, it is still a little bit unbelievable, because how would they develop a rash from conversion disorder? I mean, you can get neurological symptoms, but usually a rash is a little bit far-fetched. Well, we'll see anyways.
Condoms. He has focal limb paralysis. The cocaine was inside the condom and is now spreading through his digestive tract.
Ew. Cool.
I love this kid. We've got a future doctor here on this plane right now. Reminds me of when I was a kid and I would wonder to myself while staring at my hand, how on earth is it moving when I want it to move? We don't think about it that frequently, but when you do, a lot of things actually need to happen to be able to just do this. Kind of mind-boggling. Sounds like what our patient was doing was some kind of body packing or pushing, which is how smugglers move illicit drugs across borders. Body pushing is when items are hidden in easily accessible orifices like the rectum, vagina, or even the ear canal have been used. Body packing is usually a little bit more of a desperate act when criminals are about to be caught and they swallow the packs of drugs to hide them from the police. Now, if this person actually has had a cocaine overdose, you would expect their heart rate to be insanely fast, pupils dilated, respiratory rate going quickly, speech being pressured, and quick, that would give things away. If the patient did swallow the packs, the surgery to remove them from his intestines would be trying to take them out before they poison him more, but surely that's not going to happen on a plane. And how does House know that he needs surgery without checking his rectum? Could save him an operation, although you'd hope that he has a translator to communicate that in Korean, otherwise it would be quite awkward.
We were wrong, which means Foreman was right.
Ball was full.
Oh, I guess at the start that the cat would have contracted the disease and could have given it to the patient. Maybe whatever this weird blue rock is radioactive or could be a heavy metal of some sort. I have to admit, I don't recognize it. Although I would probably want a hazmat suit now if I were Chase. Did you know that Chase has gotten the diagnosis right more times than anyone else on House's team? We can see why here though. Smart dude. I need to hear this answer.
Okay, hold him tight. Pressure on his joints relieves his pain.
Was he just about to operate looking for the drug packs without checking the rectum? I know you're on a plane, House, but you just can't help living life at 200 miles an hour. The fact this patient has unusual sensations, vomiting, joint pain, rash and ataxia now makes me think that he either has amyloidosis or mastocytosis. Come on, let me beat House to it. It's got to happen at some point.
Scuba certification card. T-Kong's scuba rental dated yesterday.
Oh, House has got it. Pang has decompression sickness because of rapid reduction in pressure. See, what happens is during a dive, body tissues absorb nitrogen from breathing gas in proportion to what the surrounding pressure is. At that pressure, the gas doesn't cause an issue, but if the pressure drops too quickly as he ascends, the nitrogen comes out of solution and starts forming bubbles in the tissues and can cause arterial gas emboli and blockages. The solution is rapid recompression or increasing the pressure again. That helps the nitrogen to redissolve back into the blood and the tissues. Oxygen really doesn't change outcomes here. But there are usually good outcomes if it's treated within 24 hours. Joint pain was relieved by the compression because the nitrogen that was present in the synovial fluid actually reduces in volume as you increase the external pressure on the bubbles. Now, that is cool. But what's the other patient got? Need to find out.
Poison gas flowed through the old pipe and into your house.
I thought I was being punished for going away, but punished for coming home.
Oh my lord. There you have it, people. Next time you're second guessing your coke-fueled frolic with El Gordo in Caracas, don't despair, because if you come home you'll be fumigated with methyl bromide and your cat will die. Something tells me that it wasn't Disney that wrote this script. Well, at least she's gonna be alright in a few days, no harm done. So basically neither of our patients really needed a doctor's intervention, except the guy on the plane who needed just a little bit of pressure. Reminds me of something a gastro consultant asked me once: how many of your actions as a doctor actually treat the patient? I was thinking about it, and 99% of the things we do actually don't treat the patient. They're just investigations or calibrations to make sure that when we do deliver that 1%, it isn't a crash landing. I actually found a scuba card in a lost wallet once. I drove half an hour to give the guy his card back on his birthday in the middle of the night because I thought he would be distressed and it would have ruined his day. He woke up and was like, didn't realize it was gone. Took the wallet and shut the door. I should have just kept it. Oh, no, I'm joking. I would never do that.
I just wanted to say thank you.
You're extremely welcome.
I'm in New York every Monday.
Are you handicap accessible?
Oh, House, you smooth, sneaky soul. Now, it's my turn to diagnose you. Looks like you have a house deficiency. Oh, look, the treatment's just popping up over there. Go on, cure yourself. Stay curious, stay grounded. What a good episode.